I remember it even 4 or 5 years ago. Doctors were like, "Are you crazy? Like, why would you ever use cannabis? That's a pathway to heroin and LSD and being a drug dealer."
How long
And
ago was this?
that was 5 years ago. Really, really recently.
Yeah,
I mean, I'm in a pretty stuffy medical area.
Yeah.
We have PH in some of the top hospitals in the world. But doctors were totally closed-minded to it. I mean, at the time, they hadn't had patients telling them how much it was helping, or they weren't listening.
Yeah.
We're graced by Dr. Rice here. Thanks for joining, man. So I'm sure he'd echo my statements that, doctors were afraid of it. We weren't taught about it. But things have changed in the last couple of years. Patients, thank God, are telling their doctors, "No, look, cannabis is helping me," or "I'm curious about it. Can you talk to me about it? Can you teach me about it? It seems like it's helping everybody else. What's missing here?" Honestly, the cannabis movement, if you think about it, all of the laws in this country were against cannabis. I mean, you can't hold it, you can't sell it, you can't buy it, you can barely grow it. All of the laws were against cannabis, and yet still it's becoming legal everywhere. That's only to the public's credit. That's the people who are like, "No, the establishment is wrong. The doctors are wrong. The politicians are wrong. This needs to be legal."
Sure. Yeah, that's how important like the collective push is on certain things, and a lot of things that I do with meditation and different things that when I'm talking to people, I'll even open it up to it's a placebo effect. I'm fine with that. I don't personally look for validation from anybody for things that I do, but also I don't want to be somebody that forces something. I mean, like I may be making this up in my mind, and I just like laugh about it, and that for some people they want specific answers, a lot of research and stuff, and I was just like, I'm gonna probably not be able to do this anymore if I do that. I mean, for my personal path. Go ahead.
Jedi, and this is really a Jedi moment. That is accidental brilliance right there. And I'm gonna tell you about two phenomena, and I'm gonna let you draw the same conclusion. In medicine, randomized controlled trials is like the gold standard of how we study stuff, and it's a certain independent variable against the placebo effect. 30% of the time, if you can believe that, almost a third of the time, the placebo effect will work. And we think about it this sugar pill idea, but we don't know what's happening. But 30% of the time, people get better. Take that to the side. I want you to consider something else then. There's this crazy herb that it seems to be good for everything. My God, there are people who have headaches. It seems to cure that. There are people who have vaginal pain. Boy, it seems to do well there. People have back pain. Oh my God, it seems like it's good for everything. Not 100% of the time, but an interesting large percentage of the time. And on the one hand, we don't know what causes the placebo effect. On the other hand, we're starting to learn about this. Oh my God, there's a whole system called the endocannabinoid system, which is in everybody and seems to be doing some kind of cool stuff.
Well, I think, and this is me being in the know spiritually. I think the placebo effect has to do with what gurus have been saying for a long time. There's lots of gurus that are out there, but it shows that the body naturally heals itself.
For sure. But I mean, no, I think what we've been trying, medicine has been trying to paint a picture missing a pretty sizable puzzle piece. The endocannabinoid system is a foundational hormone in the human body. I mean, it's in almost every cell. It's a fundamental way that we can communicate. Our cells communicate. It's a feedback mechanism that stops things from going wrong and rights things that have gone wrong. To imagine that we can practice medicine without like dopamine or without serotonin seems silly, right? Like how can you know what a human is if you don't have dopamine or if you don't have serotonin understanding? I think the same thing is true of the endocannabinoid system. You can't have baseball without a bat, man.